Well, good afternoon and welcome to the Flint Community Webinar on Coronavirus. We're excited that you joined us today, August the 5th, for this 125 weeks of conversation around coronavirus and related issues, bringing a local context to this global pandemic. Today, the webinar is being brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. I'm excited today to be your moderator, Yvonne Lewis, as a co-director of the Healthy Flint Research Coordinating Center. And of course, we would not be able to do this webinar or have all of this information provided for you if it were not for the community partners that have joined us each week to share information with you about what's going on in our community, not only around coronavirus, but we have also expanded to addressing other related issues that were affected by coronavirus. We want to also say to you that it's been an opportunity for us to talk about a variety of issues. In this month, we're looking at vaccinations. And of course, you've heard so often about the importance of vaccinations. We'll talk a little bit about that today, but this is National Immunization Awareness Month for adults and for children. We've been focused a lot on children vaccines. During COVID, it's an everybody vaccine, but there are many other vaccines that we also want to give attention to about around immunizations for our community. And so today, we have a very exciting program for you today. We're going to be having a special guest with us, Essence Wilson, who will share some important information about housing as it relates to COVID. We also have, we're going to be talking about the Monkeypox and what we need to know about that, and some other information that's come up about long COVID. We're also going to have an update from the Genesee County Health Department, our equity brief, as well as the city of Flint. And so today, we really want to get started with our roundtable. We're excited that Dr. Hackert has joined us today to give us some information. This is really, really right now information. Some of us have been really concerned about what we've been hearing in the news. And of course, our health officer, Dr. Pamela Hackert, is here to give us an update, and it'll be followed by some additional information from some of our roundtable team. So Dr. Hackert, welcome this afternoon. Thank you for joining us.
Been kind of a fly in at the last minute kind of day, so it's great to be here and in the place I know I belong at noon on Fridays. May I share my screen then with this?
Of course, always.
Okay. Let's see. Pull this over here in front of me and move everybody else off of my screen there. Okay. All right. So there were some follow-up questions about why is testing not as accurate with these newer Omicron variants, and we know that they are not. Oh, I lost my quote. I lost my quote.
We can't see your screen, Dr. Hackert.
You cannot see it?
No.
Oh. I bet you kind of is over here. Can you see it now?
Yes.
Well, unfortunately, then you're going to see the side of my face. So I'm going to take myself off of camera because I don't like my side profile necessarily. Can you see it now with my screen?
Yes, actually, we see your presentation.
All right. Good. All right. So let me do the slideshow. Sorry, I'm still have the little thing in my throat from COVID. Can you see it now?
We do see your screen, but it's not in slide presentation, but we can see the screen.
Oh. All right, we'll just go back with not a slide presentation. Let me exit this. Now you can see the other one with the notes along the side.
We do see the notes on the side, yes.
Okay, all right. So we'll just leave it that way then. And somehow when I was having trouble with the computer, it seems to be happening a lot lately. We are switching over from our health department website to a county hosted website. That's a little up in the air. And then we are also eventually getting different emails. And so it's all kind of in transition, and we are having problems sometimes. So I had a little tiny quote there, but no worries. So in Omicron, you have a lot more mutations than before. And the way that they designed these tests were to pick up specific points on the spike proteins of the virus. And I have absolutely no doubt that everyone on this call can now think about in their head what the COVID-19 virus looks like. And so think, in fact, there's a little graphic there on the one person's thing. And so it's that spike protein. So when you have more mutations and when you have fewer matches to the spike proteins that were being picked up in the original antigen test, or the same antigen test, but now we have different viruses, it's not as accurate as it was. And here's like a few things to keep in mind. It is less accurate in people without symptoms. So if you have symptoms and your test is negative, you should retest the next day and each day as your symptoms continue for at least a week. If the symptoms worsen, particularly if you're experiencing any kind of breathing problems, shortness of breath, severe coughing, contact your doctor. I know a lot of people think of shortness of breath as the feeling like you can't, kind of catch your breath, like you don't, when you try and breathe in, it's not working as well as it normally would, or it makes you want to cough. But remember too that shortness of breath can actually be apnea, where you just don't breathe. Like you may find yourself not breathing as long, just like people know about sleep apnea. You can get apnea from an infection as well. And so I was seeing some younger patients, like in their 20s, who were occupationally exposed the first year of COVID, and they seemed quite healthy. But if you actually took a pulse oxygenation of their fingertip, you just put that little thing on your finger, their oxygenation was about 86 to 89%, and they just weren't breathing as much. It kind of ruined their need to breathe. It is more accurate in people who are being tested if they are household contacts rather than a contact like out in the community. And it's also more accurate within the first week of infection. So it doesn't really give us a solution, but it does give you a little bit of hints of just keep testing. Also, you can always go to a Pcr test, which is a little bit more accurate. And that would be something that you would normally schedule. Some places are still doing it drive-through or walk up, but often you have to schedule that. And they are more accurate. If you don't have any symptoms also, and you really know you had an exposure, so you have what's called an epi-link, epidemiological link, say a family member or a event that you were at, a lot of people became COVID positive, you do want to call your doctor and just say, look, I have symptoms. I haven't been exposed to anything but COVID, and I know I was exposed to COVID. My tests are negative, and I'm getting, quite ill. Like you wouldn't want to necessarily do that if you weren't significantly ill, but I'm getting quite ill. So they may want to treat you even without a positive test. So I found this nice little infographic. Well, it's not an infographic. I found this little map here, and you can see right here in the middle, right there, this one, it's like in there is the original one, and it doesn't show up as well on this, but nonetheless, you can see. So if you think of the closer this is to the original one, the closer it's going to be more accurate testing, the better our monoclonal antibodies would have worked. And so Delta was not very much away from it. And then we see like the beta and the gamma, the ones that really never took off a lot. But then look here, Omicron BA2, well, alpha was here. So alpha was very close. BA1 was down here, still within this kind of area. BA2, you can see it really wasn't from the original Omicron. It kind of came out separately. But here we see why this is such a problem with BA5. It's way out there, sort of like, the Pluto before it became a not planet. I'm old enough to think of Pluto as one of the original planets, and that's not any longer true. So keep the faith, keep on testing, because if you test, it makes things so much easier, and also you can make sure that your contacts are aware of it as well. But I also know that people have been very interested in the new vaccine that's coming out this fall. This is called the Novavax, and it is originally, like, I'm going to go into this a little bit more. So people who have a strong science background will think, oh, please stop making it so simple. People who don't have a strong science background may think, stop making this so complicated. I want to go into just a little bit about how it is made compared to the monoclonal antibodies, so people can see. This is how most vaccines are made. They've always been made this way. They take a virus, the single strand of a virus. So if you remember back from even high school, junior high biology, when you are looking at conceiving a baby, you get a single strand from the dad, a single strand from the mom, and it converts it into a double-stranded DNA. And the same thing with this virus. So they took the virus, made it into a double-stranded. They didn't change anything, just put two of them together. And then they put this into the DNA into a virus that affects moth cells. They wanted something that humans had never been exposed to before, and we've never been exposed to a moth virus. So that went into the nucleus of a moth virus, and I put this picture there just to show that I wasn't not enunciating. It really is a moth virus. And then that started to produce its own RNA because it's been exposed now to the coronavirus spike proteins. And so this moth virus now is acting like a spike protein factory. They collected all those spike proteins from the moth virus, and then they added an adjuvant from this tree, and I'll not even bother to say it, but they added that to kind of like make it perkier. I saw it described, doctors really like to describe things in terms of food, and someone said it's like adding lemon zest to a otherwise bland, dessert or something. So they wanted to be able to perk up the our body's recognition of the vaccine. And by putting this adjuvant in there, that's what it does. It's making it much more aware in your body. The Novavax is what it's called. It's for 18 years and older, 2 doses given 3 to 8 weeks apart. Currently, there's no booster authorized, and it does not contain eggs, preservatives, latex, or metals. So the next one, we are currently in, so I was going to show you what the results of the phase 3 trial was. The phase 3 trials portion of releasing new vaccines or other medicines is for efficacy, to see how well it performs against other things that are already available. So they put about 30,000 people in the study. 1/3 were placebo. They didn't really get the vaccine. They got something else. And 2/3 were the vaccine. It was called Prevent 19, if you wanted to look it up. And the dates that they included in this trial were before Delta and Omicron. So it was from December of the original year to middle of February of 2021. And in that study, it was about 90% efficacious with no severe cases or deaths. The side effects were mild, included fever, chills, tiredness, headache. These are like very common vaccine side effects. These again, though, did show up more after the second dose, which is normal because your body's now seen it once before. So this was the interesting piece. And I know there was a lot of concern with the myocarditis that was seen with the Moderna, actually it was the Pfizer, but with the mRNA vaccines in those mostly young men. And we want to keep things in perspective. And I recall talking about this before. So when we had the other mRNA vaccines, the Pfizer and the Moderna, the risk of myocarditis, which is just inflammation of your heart, is about 1 in 100,000 vaccinated people. But if you get COVID infection, there's about 140 times that. So with COVID infection, and this is continuing with Omicron and with everything else, about 140 cases of myocarditis per 100,000. So we know that all sorts of different viruses can cause myocarditis. My son was 19 years old when he had finals and had a virus while he was studying for finals, and he seemed to get better for about 2 weeks. And then when we went on a family trip to Japan, on the way home from Japan, he got chest pain and really tired. And I took him immediately to the emergency room because I was worried it was a pulmonary embolism, blood clot in his lungs from flying. And it turned out he had very severe myocarditis. They at first thought he might need to have a heart transplant. And the nurse later on told me that she kept calling down to the emergency room 3 times saying, I think you made an error on his age. Could you please fix that? I've asked before. It says 19 and he should be 91. And they're like, no, it's a 19-year-old. So he was a very healthy guy and he's fully recovered. So that's very nice. But so this is the piece that I know I'm telling you that because I want to really convey how much any virus can give you myocarditis. And yes, the vaccines, we know it did cause about 1 in 100,000, but it's still less than getting myocarditis from COVID. With Novavax, and so the message, the mRNA vaccines, when they saw the myocarditis, it was after they had already released the vaccines, done a lot of testing. There was a very high testing, no incidence of myocarditis. With Novavax, though, this is a little different. There were 5 cases of myocarditis in the pre-authorization vaccine recipients. So before this got released to be able to give to the public, which it now has, they found 5 cases of myocarditis, whereas with the mRNA vaccine, they had found no cases of myocarditis. So we're really not sure exactly if this is a kind of a bad luck kind of thing, or if it may actually be an increase of myocarditis more than the prior mRNA vaccines. However, it's still going to be much less than the 140 cases that you see per 100,000 people with COVID-19. And so we wanted to stay tuned on that. So I'm going to see if I can take you off of screen sharing here. Okay, thank you. Someone did it for me. Appreciate that. And I will take my video back on. Well, maybe I won't. Trying to. So if there's other questions, I'm happy to take them. I don't want to, hog the time, and I will move on and then let people ask questions later.
So Dr. Hackett, I know you're making it clear to us that there's still more to come on the Omicron variant, that they're still out there, and that we need to continue to be mindful and be careful. Mm-hmm. And so you gave us some good insights on that. And I just want to ask one other question, because there was an interest in monkeypox. I don't know if you have an opportunity to talk to that, and then we'll come back because Dr. Reynolds has some additional information on long COVID. So if you can just give us a quick update.
And you want a quick update on monkeypox?
Yes.
It's not quick, but I know. So last Monday we released that we had the first case in Genesee County, and I mean within 60 seconds of Kaylee hitting send, we got a call that it was actually our epidemiologist discovered that it was actually not a case in Genesee County resident. It was actually a different case. So, but we do have the press release ready to go because it is going to be coming here. There's no boundaries in public health. And so we do have the vaccines available now. And people can call. We're a hub for the surrounding areas. The vaccines are available for people who are a known contact within the last 2 weeks. And depending on how our supply holds up, it would also be potentially available for those who attended an event where there are known cases, even if they're not sure if they had intimate contact with a certain case of monkeypox person. So those are things you can call here, and we will be screening that. We're trying to separate into 2 different pathways to be sensitive to who may be being exposed, and we do expect more exposures going down the not sexually transmitted pathway, because you can get it from skin to skin contact. You can get it from, if you have a lesion in your mouth and you kiss someone, you could potentially get it from that. One little detail just to kind of hit home, that it's not at all similar to COVID, which is like measles right now. Like you can get it as easily as measles breathing in air that someone walked through an hour ago. However, you can transmit it by air, but it's usually more like breathing in the same air for over a 3-hour period as someone who has it. That could be a potential exposure. So if you're in a car with someone for half an hour, you are not exposed. If you're on a bus with someone, you're not exposed. If you are sitting in an enclosed car and you're taking a trip to Minnesota, yeah, you're exposed. But it also has, they don't know many things about it yet, but they theorize that the skin flakes that we all have, and if you think about it very much, I tend to want to change my bed sheets. But those little microscopic flakes, people are suspecting that it might be inhaling that, which could be that inhalation exposure. So very different than perhaps like most other things.
Thank you, Dr. Hacker. We've got a couple questions, but I want to just make sure I get Dr. Reynolds in here right quick, and then we'll answer a couple of questions that are in the queue for those of you that can respond to those questions for us. Dr. Reynolds.
Well, it's tough following a public health director who is also a lawyer and also occupational medicine. But speaking as a pediatrician, the parents of my patients work. And, we've talked about essential workers, and then we're finding out, well, in a complex society like ours, everybody is essential and their roles are interrelated. And that brings to the discussion long COVID, because you can have a job, and if there's not an awareness of long COVID and you're having changes in normal function related to long COVID that are not recognized by an employer, physician, or your disability insurance, you're in trouble. So our government just issued 2 reports, August 3rd. It's on the website hhs.gov, hhs.gov. And the director of HHS shared this information. Between 7.7 to 23 million Americans have developed long COVID, and roughly 1 million people out of the workforce at any given time are because of long COVID. So this is nothing, it's not a small problem, it's a significant problem. And so they issued 2 reports, one on the research efforts, which I won't discuss, but I will talk about the summary of a 124-page document that I have yet to complete because I just saw it this morning about the services for people with long COVID. And the take-home message is this: there are symptoms. The symptoms are both physical, mental, and emotional. And the criteria for something being a problem, if it affects your normal function or prevents you from engaging in one or more major life activities. And that could be eating, sleeping, and all those things that we require for what we call activities of daily living. So it's imperative that when people get these groups of symptoms that we have yet to define clearly, but if there's a concern after a COVID infection that these symptoms persist, it's worth pursuing. And if it's causing you to have a disability, it's worth pursuing, because for many people, it determines their employment status and their ability to earn income for their family. Now, I'll stop right there.
Thank you. Thank you so much, Dr. Reynolds. And I wanted to just make sure we got just a couple minutes left for our roundtable before we get to some of the other questions of some of the other presentations for today. But I also wanted to just make sure that there was a question that was asked in the Q&A. Who would this vaccine that Dr. Hackett mentioned, who would this vaccine be for, and who for people who have never been vaccinated? Who would this new vaccine be for, and people who have never been vaccinated for COVID?
I did answer that, and so it is for people who are not yet vaccinated.
All right, thank you. Last comment from our other resident pediatrician, Dr. Wolford. Did you have an update?
Good afternoon, Yvonne. Yes, my one comment is that we've talked a lot about vaccines, and we see how helpful they are in many, many situations. And so I don't want us in this setting to forget the regular vaccines, the routine vaccines that children and adults, because I often forget the adults, children and adults should get, right? The reason why we're in a fairly good position where monkeypox is concerned is because we had vaccines for smallpox, which we were able to eradicate, which is a vaccine success story. And though the vaccines that we had for smallpox are now able to be used to help us with monkeypox, well, we have a lot of vaccines for a number of illnesses that we do not want to come back and begin to affect our population and our children. So don't forget to get the routine vaccines as well as we're thinking about all these new ones.
Thank you, Dr. Wolford. Thank you, Dr. Reynolds. And thank you, Dr. Hacker, for that really important information for today. One of the other things that we wanted to talk about is sometimes the impact of COVID on other issues. So today we have with us Essence Wilson. She's going to take a few minutes and she's going to talk to us about communities first, because we also want to highlight some of our community activities that are going on and how this program is interacting, interfacing, connecting COVID and housing. Essence.
Hello, thank you for the invitation to be with you today. I want to share a little bit about our organization, Communities First, and then I have some interesting information, data, and statistics about housing and how that interfaces with the work that's happened towards vaccination and also with the pandemic. So Communities First, our motto is empowering people, building communities. Our organization started in 2010, and we're Flint based, but serving across the state of Michigan and also into Indiana. We have 3 focus areas. They are equitable real estate development, engaged communities, and economic mobility. So one of the things that we really pride ourselves on is responding to community needs. And obviously, when the pandemic hit, there was a lot of work that needed to be done in a very short time period. We serve about 35,000 individuals annually, and we have created or preserved over 500 units of safe, affordable housing. We have about 250 folks that volunteer with us every year, which I'm also really excited about. Our mission is to build healthy, vibrant communities through economic development, affordable housing, and innovative programming. So we do community development work, we build affordable housing, and then we also do rehabilitation of existing buildings. So I just wanted to show you guys some of the images. Probably the newest announcement that you've heard about is the Grand Island University, which is on the corner of Grand Traverse and University Avenue, where we're building 48 units of housing, and we just had a groundbreaking ceremony. I believe it was last week. The days are going by so quickly. So we're really excited about getting started with construction on that one. And then there's just some images just to give context for folks of our work in the community. So there's Coolidge Park Apartments, Oak Street Senior Apartments, Swayze Court Apartments, Berkeley Place Apartments, and Georgia Manor that are shown here. And then there are a couple of others that we didn't construct, but that we acquired to preserve affordable housing for individuals in our community. So in addition to our direct housing work and the development and construction of housing, we also have a number of supportive services and family programs that happen both inside of those apartment complexes and just open to the broader community. So we do things like, I think on the left, we were doing yoga with some of our seniors. Our residents have different committees that they sit on. And really that's all about empowering them to be able to make decisions and choices related to the environment that they live in and the things that are important to them. We also do something called Movies Under the Stars, which is an outdoor movie event. And again, most of the things that we do related to programming come about as a result of a volunteer, a staff person, or just an emerging community need that we have the ability to fill, and that also aligns with our mission. And so then I think the link was dropped in the chat. For more information about our organization, you can go to communitiesfirstinc.org. We're on Facebook, we're on Twitter, we're also on Instagram, and you can always email us at info@communitiesfirstinc.org. So I just wanted to share that information to give context, and we can take the presentation down, and then I'll just talk briefly, because there's a lot of great information that's coming forth in this webinar, but about housing. So some of you may realize and others may not, but we are in the midst of a housing crisis in all honesty. And I think for those of us who have stable housing, sometimes it's not on our radar because we're not directly impacted. But for a long time, housing was not recognized as a basic need or as a social determinant of health. But thankfully, those conversations have and are turning around. When we typically talk about issues like homelessness, the popular solution is for that person to just, go and get a job, right? But that's an unfair assumption that we can make, because it would be a red flag for any employer to get an application and see that the person has no address listed, or that they're listing, a shelter or something like that. And even if that person were to get a job, transportation is going to be a challenge, and then maintaining proper hygiene. So we have to think much more holistically about how we address housing needs in our community, and not feel like, there's just a one solution or, an easy solution to our housing issues. So in Genesee County, there is a need, and this was identified by our Genesee County government, that we need about another 5,000 affordable housing units. And every night in our community, there are about 200 to 250 people experiencing homelessness. We actually did a little bit of a study where we looked at all of the apartment buildings and mobile home communities that have closed in about the last 15 years. And there have been about 2,000 units of rental housing that have either closed or been condemned, but have not been replaced at that same pace. When we think about housing insecurity, it has been associated with higher rates of depression, higher rates of suspension and expulsion from school, an increase in chronic health conditions. And just to speak on that point about suspensions and expulsions, there was an article in the Flint Journal several months ago, but it talked about the disproportionate number of students who were suspended that were experiencing homelessness. And there are a lot of thoughts and theories about why that may have been, but I couldn't imagine the trauma for a child to not have a safe place to live, but also be expected to come to school and still perform and still be, well behaved when they're dealing with so many different emotions, feelings, and issues at home. But in the midst of the pandemic, housing security definitely made it difficult for households to comply with public health measures like quarantining or restricting their number of close contacts, because some of those families were transient. Housing is a very complex issue, as I stated before, with no easy solution. If we look back to the end of 2021, there were more than 10 million rental households across the country that were behind on rent, and more than 2 million homeowners fell behind on their mortgages. And one of the things that I did see in some of the data that I was looking at was that the percentage of households who lost housing were significantly higher for communities of color. And then those households that had incomes that were less than $75,000 were twice as likely to be behind on their rental or mortgage payment at the height of the pandemic. So those, households, and 75,000 isn't even the low income threshold, but we did see that they were twice as likely to be behind. So I know that the folks that are on this call and that are probably watching this webinar know much more about it than I do in relation to the health and stress impacts that people have experienced during COVID-19. We were very fortunate that there were several programs, several government programs that were designed to help meet some of those housing needs, and they probably prevented a total collapse of our housing market. So there was an expansion of dollars to support those experiencing homelessness through the Emergency Solutions Grant Program, and those increases occurred at the city, county, state, and federal levels. Then there was about another $30 million in funding through the SARA program, which is the COVID-19 Emergency Rental Assistance Program that was pumped into Genesee County and administered through the Michigan State Housing Development Authority. Those funds were accessed through, individuals could access those funds through Catholic Charities and also through G-Card. And those programs have sunsetted or will be sunsetting very soon. And I think, one of the things is $30 million sounds like a lot of money, and it is a lot of money. But when we think about what the needs were and the fact that all of those dollars were helpful, but none of those dollars could be used to actually either convert, construct, or preserve housing. Those were specifically dollars to support rental assistance. So someone who got behind, they needed to stay where they were, but didn't address the fact that we have an aging housing stock, and that, there are people who move between communities and they had nowhere to rent, or even buying a home was an extreme challenge. So we do have ARPA funds in our community, so the American Rescue Plan Act funds that could be used for housing purposes, but it's definitely up to local units of government to make housing an allowable use and to allocate those funds accordingly to address those needs. So a couple of the trends that we noticed during the pandemic that were very interesting and also very concerning. There was a tendency, and there still is a tendency, for landlords to increase rental prices to levels that were absolutely unaffordable. And in some cases, people who had and have housing choice vouchers, formerly known as Section 8, those vouchers would no longer cover the rents because the rents were so astronomically high. And those individuals had to figure out what they were going to do. And so the result of that in a very short time period was, bigger profits for some of those landlords who were taking advantage of the housing prices, and then also families being displaced. We also have an issue with poor housing conditions, particularly for lower income individuals. Many homes that have been rented are unsafe or unfit for human habitation. I remember working with one mother who had either 2 or 3 children to get her family relocated because they had mold in the home and it was leading to asthma and breathing issues. And then several apartment complexes during the pandemic have changed ownership and no longer accept either housing choice vouchers or other forms of rental assistance. Fortunately, locally and at a statewide level, there are agencies that are working on legislation that will prevent source of income discrimination and hopefully protect those who are using vouchers to help pay their rent. So I know I only had a few minutes to just try and get a lot of information out there, but I just want to stress that housing is indeed a public health issue, and it's really important for our individual and collective well-being in our community to address the housing needs as they continue to grow.
And I know that there are lots of questions about it, but we wanted to make sure, as we're highlighting things that are going on in our community, that our community members see that there are community organizations that are working to help address these needs, even in the midst of COVID. So thank you so much. And so we're going to appreciate you coming on with us today. And now we're going to just shift back a little bit and really look at, with all the things that are going on, what are some of the trends and what are some of the data telling us about COVID? And Alan's going to help us with that.
Yes. Yeah. Thank you for having me. Just an update as far as COVID cases within Genesee County and within the city of Flint. The summertime lull is basically over. So We're seeing the increases like we've projected them. If you look at the rest of the country, when they're experiencing a surge of cases, Michigan and sort of northeast regions of the country have not experienced at the same level. But we are going to see an increase. Everyone's going back to school soon, and then the weather is going to get cold, so everyone's going to be back inside. So that's kind of what you can see into the future. As far as when it's going to peak, they don't know, because this latest variation or variant has that reinfection sort of variable that makes it hard to project when these cases will go back down. So, and then next slide, a couple of weeks ago, Dr. Hackert reported on these numbers, but we put it into graph form. So this is from the health department. So I just thought it was an interesting way to look at data through the years. So the purple being 2020, and then green being 2021, and then 2022 is this yellow. So how the variants behave differently in different years, and we try to see some patterns, some seasonal patterns, but with new variants, it makes it hard to know for sure when a case is going to surge.
So thank you, Alan. And we're just looking at the fact that there are consistency in the fact that things are changing, and we need to pay attention to those changes and really follow those protocols that we've been asked to. Everybody just please do what we can to remain safe. There are a lot of questions out here that are not fully answered yet, but we're looking at how we can work as a community to have those solutions work for us. And so another representation from the health department, Michaela's going to come. She's the epidemiologist at the health department, and she's going to give us an additional update from the health department perspective. Michaela.
Hi, thank you for having me. I'm just filling in for our emergency preparedness coordinator, Ashley Herbig. She let me know yesterday to give just a quick update on our vaccine clinics and testing sites, and then a quick update on monkeypox, but I know Dr. Hackert covered that. So yes, just as we have here on the screen, we have no big changes in our vaccination sites. We still have our 3 standing clinics on our rotating schedule at the Central Church of the Nazarene, Shiloh Missionary Baptist Church, and Our Lady of Guadalupe. And also our pop-up clinics are here on the calendar as well. And this is always available on our website for the calendar as well. And then of course, here we also have our 3 community testing sites, and they do at these sites the rapid antigen testing, and also I believe the PCR testing is available upon request at these 3 sites. And then again, these are some just additional testing and vaccination sites, not necessarily affiliated with the health department, but still available to our residents of Genesee County. And then yes, here, this is the number here for our COVID-19 call center. We have folks available to answer any questions that our community members have. And then our website information is also listed here for the vaccines. And at the very bottom, just our general website for anything folks might need to go there. And I will just also mention right on the homepage of our website, we do have some information about the monkeypox virus. So if folks have questions there, it lists different things like symptoms of the virus, where to get tested. It has our phone number. Like Dr. Hackert said, we are prepared here at the health department to see patients who may need to get either tested or vaccinated. So folks should feel free to just call us, and we will schedule an appointment for either vaccination or testing, whatever folks need to have when they come to see us. And we do have 2 of our wonderful health educators available to answer any questions that folks may have that they either didn't see on the website or they're wanting more details. We do have those folks available here to answer those questions.
Michaela, this question for you, and maybe Dr. Hacker can also chime in on us, but what's the test for monkeypox?
So the test for monkeypox is a swab of the lesions. So what we have been directed by the Bureau of Labs through the Michigan Department of Health and Human Services is, if possible, we are seeing a wide variety of the number of lesions that folks have. So some folks are showing, maybe just 1 or 2 lesions, while others have, several. If possible, we do like to take samples from 3 different sites. So for example, like say you had a lesion on both your right arm, your left arm, and then one on one of your legs. We would take 2 swabs from each one of those sites, and those would be sent off for testing. So it's not an invasive test or anything like that. It's just a swabbing of the lesions that folks have.
You're talking about lesions, you're talking about like an open sore?
It doesn't necessarily have to be open, but yes, the sore, correct.
Okay. And so that would have to, they would go directly into the health department to get that test done.
Yes, we do have all of the supplies and the testing equipment, all of the PPE for our staff. We are well equipped to do that testing should folks need that.
I'm just going to interrupt for one piece of that is if it is a contact, a sexual contact that you need the testing from, you would be seen in our STD clinic where you'd be offered other STD testing. If you are a household contact, you would actually be seen through our immunization department. We're trying to keep that a little bit separate, but in reality, many other places in the community, including your private provider, would probably be able to do this. It's just a synthetic swab that they do, and then they put it in the thing. So if they'll swab you for an NP, like if they swab you for like strep throat, they should be able to swab you for this. You wouldn't always need to come here because we really don't want to make people wait longer than they would have to otherwise.
Okay.
Thanks,
So
Dr. Hacker.
they can see their family or primary care physician for that as well.
If it's someone who can do swabs of your throat, they should be able to swab the sore. If the physician or other care provider wanted some guidance on that, they could certainly call, but it's kind of all over the doctor internet how to do it.
Right. Thank you so much. Any other comments, Michaela?
Oh, I did just want to mention one more thing that I almost forgot. Ashley did want me to mention, I think she showed it on one of the previous weeks, but we have a flyer available. I think it was sent to someone at your group about the Flint and Genesee County cooling stations. She did just want me to let you know that is still all the same, no changes or updates to that. So that is still all accurate information. And that is my last update.
All right. Thank you so much for that.
Mhm.
I appreciate that. And thank you for, there it is. There's the cooling stations, and we want to make sure that our community knows that those cooling stations are available at Carriagetown Ministry, Oak Street Health, Hasselbring Community Center, Hasselbring Senior Center, excuse me, Center for Hope. And that's started July 5th. North End Soup Kitchen, Burton Senior Center, and the Brennan Center, all available, as well as hydration stations at Street and Path Outreach, Carriagetown Ministries, and the Center for Hope. Thank you so much for that update. And now we'll hear an update from the city of Flint. Katie.
Good morning. Thank you for having us on. A few items I'd like to share with you today. The Canusa Games are this weekend. This has been going on between the city of Flint and the city of Hamilton, Ontario for the past many, many years. And we're excited. This is Flint's year to host the game. So we'll have athletes in town from Hamilton, and we just wish everyone a great competition day. Our next item is our Access to Capital event. This is coming up at Burston Fieldhouse on August 10th. I'm going to drop a link in the chat where you can get more information. And this is for both new businesses and existing businesses to be able to access loans and other types of funding to grow or start their businesses. Finally, I want to share a little bit of information about our Community Navigator pilot program. This is funded by the Federal Small Business Administration, and it allows the City of Flint to provide technical assistance to, again, both new and existing small businesses. And we are able to connect these businesses to a huge variety of resources. They can get help with business plans that allow them to become eligible for funding. You can get marketing support. You can get free accounting software. And each one of these partner organizations provides different services to help those businesses grow within the City of Flint. Again, I'm going to drop in the chat. The contact for this is Tyler Bailey, our small business specialist. And if you have a favorite local business that you would like to see grow, send them this information. We'll get them connected to all of the resources that they need. That's all I've got for you today. Thank you so much for having us on.
Thank you so much for sharing that information. And we certainly want to make sure that we appreciate all of our partners. And one additional way that we're going to do that, we're going to ask Dr. Wolford if she would come up. One of the things that the Healthy Flint Research is working on is a symposium. And every year since, except for when we were in COVID, we wanted to appreciate all of the partners that are doing some research in this area and partnering together. So Dr. Wolford.
Thank you so much, Yvonne, for this opportunity to highlight this year's symposium. So the Healthy Flint Research Coordinating Center Symposium this year is on September 30th, Friday, September 30th. So please mark your calendar. We really, really hope that every one of you will be present. It will be in person again this year. As you may recall, we were in person for a couple, 3 years, and then we were about to have it in March 20th of 2020, and then the pandemic started. And so we started this webinar, which we've been continuing since then. We've had online symposia since during COVID, but this year we are hopeful that we'll be doing it in person on September 30th in Flint at the Riverfront Center. And we're hoping that each one of you can be there, and please tell your network about it so they can be there too. We want this symposium to really provide information, inspiration, and foster interconnection. And we will be having posters. Many people have submitted posters, and those will be on display with their authors there so that you can interact with them to be able to learn more about the research that's happening in Flint. We have networking sessions so that we can foster those connections between academics and the community and others so that more and enhanced and informative research can occur that will help improve health in Flint and beyond. And we really do believe we will be inspiring new work by that time spent together in the same space. Our theme this year is the long road ahead, building capacity, building partnership. Now, one thing I'd like to emphasize is that, as you know, the HFRCC is all about partnership. We can't do any of this by ourselves. And so we had opened the call for abstracts and responded and submitted your abstracts. And so that part now is complete. And now we have opened the opportunity to please submit people that you would like to recognize for their work in Flint. We have a number of awards for those who have been in their careers for a long time. We have early career awards. We have those for academics and those for community members. We have awards for partnerships, but we need you to nominate those who you think have made a difference for the health of Flint residents. So if you would please follow the link that I believe has been put in the chat and give us your nominations so that we can recognize and celebrate those who are making a difference in Flint. So with that, Yvonne, is there any other information that you'd like me to provide? I could talk about this symposium forever because I am incredibly excited about it. It's one of the few events that brings together academics and community members around research, with both groups being equally important to what occurs on that day.
And there is so much happening again in our community, a lot of projects that are going on. So it would be really, really nice to hear about those projects and ensure that we're sharing information about those projects on this during the symposium and even during our webinar. One of the things that we want to do is make sure that we touch on those things. Dr. Whitford, you were going to.
One thing I forgot is student involvement. So we really, really want to have as many students there as possible. We have awards for students, and we'll actually have some students helping. So if you're a community member and you feel like, you know what, I am not so familiar with research and maybe I won't enjoy this event as much as maybe an academic would. Really, that is, we have thought about that. The community core has really helped to be sure that what the information that we are providing will be accessible to all. If you like the information that's provided on the webinar, you'll like the information there. And then there will be students there who will be able to help us navigate that day and get the most out of it.
Thank you, Dr. Wolford. And one of the things we also want to share today is there was a commercial that's been airing to really, the goal is to showcase all of you partners that have been a part of this webinar and get other people to come and share in this webinar so that all of us can benefit from the information that's being shared. We appreciate each one of you for what you have done in this community over the last 2 years. And we know that there's so much, much more to be done. And we look forward to you helping us continue to get this word out. So thank you so much for that. And as we prepare to close the webinar today, it is going to be an exciting week next week because we will hear Dr. Wilford in a medical moment. She's going to give us some good insights on what's coming up in the next webinar.
We're gonna do a medical moment on monkeypox. So we'll get Dr. Hackett got us started today. And so next week, we're going to delve into this virus, and so we can learn more about where it came from, how it acts. So please, if you have questions, specific questions about it, send them to us so that I can be sure to address it in the medical moment next week.
Thank you, Dr. Wolford. And as we say, as we close each one of these webinars, this is an opportunity for our community health workers as well as our social workers to obtain those contact hours. So please stay on a few minutes following the webinar so that you can apply for those continuing education units and apply for those social work credits. You are also helping us to get this word out in the community. And if there are questions that members of community are asking, please feel free to let us know what those questions are so that we can be clear about answering those questions for you. And so again, following the webinar, we want to make sure that you get those social work credits. We want to encourage you to like us on Facebook, subscribe to the Healthy Flint YouTube channel. And of course, you can always email us at info@hfrcc.org, or you can give us a call at 810-835-2130. Again, we look forward to continuing to share this information with you and make sure that we are responding to the questions that you have, not only around coronavirus, but around the other issues that are so critically relevant in our community. So we want to thank you for joining us today, and we look forward to you being with us next week right here for the Flint Community Webinar Coronavirus, sponsored by the Healthy Flint Research Coordinating Center, Flint Center for Health Equity Solutions, and the Prevention Research Center. We thank you so much for joining us, and we look forward to seeing you again next week.